Well, hello and welcome to Thursday's educational webinar on the basics of Medicare in detail. So everything you need to know explained in the simplest terms possible. So let's go ahead and get started. My name is John. I'm president of Riley and Associates. We are a local independent insurance agency specializing exclusively in Medicare. Our goal is to keep things simple. However, there is a lot to cover. We'll go over the basics of Medicare, your options, your two options, and then our services, how we can help you. So today I'm going to take you through much of what we go through with our clients during the personalized presentation following their discovery call. So with our clients, we go into specific recommendations and costs based on their needs assessment. So today we'll keep that generic, obviously, but it will give you a good idea of what you can expect. Medicare has a lot of details and rules and deadlines, so we'll be covering quite a bit, as I mentioned, but hopefully we'll get as many of your questions answered as possible. Okay. So what is Medicare? Well, Medicare is health insurance provided by the federal government for those age 65 and older and those under 65 with certain disabilities. Now, most people are eligible for Medicare's Part A and Part B if they are 65 and either they or a spouse has paid into the system for 10 years or 40 quarters. Medicare has four parts. We're going to begin by looking at just two parts called Original Medicare. Part A and Part B are known as Original Medicare, and everybody must sign up and get Original Medicare to begin with. So you either enroll 2 to 3 months prior to your 65th birthday or the day that you retire and come off your large group employer plan. Okay, so it's going to be effective based on your Part B date. So Part A is your hospital insurance. This covers things like doctor or hospital stays, inpatient skilled nursing, that sort of thing. Part B is your medical insurance. This covers things like doctor visits, labs, x-rays, diagnostics, and outpatient services. So Part A is free for most people, and Part B does come with a premium. For most people, the premium is $202.90 for 2026, but it's higher or adjusted higher for higher income earners. So we'll look at a chart here in just a few minutes. So now that you know about Original Medicare, Part A and Part B, let's put this all together. So Medicare has four parts. So Part A and Part B here is your core health insurance, which covers facility and medical services. Part C is also known as an Advantage plan, and it's an alternative way to receive Part A and Part B and works much like an HMO. Part D helps to cover drugs, your prescription drug coverage. Okay. So as you'll see, you only have really two options. You have Original Medicare, Part A and Part B, and you would purchase a Part D and a supplemental plan, which we'll take a look at here in just a little bit. Or your second option is going to be a Part C Advantage plan, which works just much like an HMO and does include prescription drugs. So those are your two options. And these two options are very similar to what you have, on an employer plan. So right now, an employer plan or your individual plan, either you have a PPO or an HMO. So a PPO is going to operate and act just like a supplemental with Original Medicare in your Part D. And then an HMO is going to operate just like an Advantage plan or Part C. So we'll go ahead and take a look at these a little bit more in detail here shortly. So before we go any further, I strongly suggest that you set up what's called a discovery call 3 months prior to your 65th birthday or when you plan to move off your large group coverage and get Part B effective date. This is why is this important? And it's because there's a lot of deadlines and you don't want to miss a step. Okay, so during this call, we determine your timeline, compare coverage, we create a schedule based on your needs, and we begin preparing your presentation and your options. So basically, we set your path, we guide you through the process, and get you enrolled on time in the right plan. Also, for employers and partners, you might that might be viewing today, we suggest a planning meeting at age 62. Just because at 62, your the income and other things that affect your income early on can affect your Part B premium when you do decide to retire. So when you look at age 62, you can actually make plans, and there's different strategies if you want to try and lower your income and move into a lower bracket or not have to pay the higher IRMA premium, which I'll show you here shortly. So we have a planning checklist and a video that better explains that. Just click the link that is here and we'll send you the information. Okay, so now let's go ahead and we'll move on to the initial enrollment period and look at other specific election windows. So this is important stuff. Okay, this is your deadlines, your enrollment windows, things that you need to know. There's three main enrollment periods that you need to understand at this point, and then a couple which I'll tell you about. So the first one's called your initial enrollment period, and this is the time when you'll sign up for original Medicare Part A and Part B, and that's, if you're working with us, that's followed by your pre-enrollment presentation and where you choose your coverage and cover those out-of-pocket costs, which we'll take a look at either through option 1 or option 2. But both coverage, your Part A and Part B generally will start on the first day of your birthday month, effective date for those that are coming into your initial enrollment period at age 65. Okay. When signing up for original Medicare Part A and Part B, you have a 7-month window here that you can sign up. Ideally, you want to sign up 2 to 3 months prior to your birthday month, but you have the 3 months prior to your birthday month, the month of your birthday month, and 3 months after your birthday month. So note, if your birthday falls on the first of the month, your effective date will begin actually on the first day of the month prior to your birthday month. So say, for example, this was April and it was April 1st was your birthday. If you sign up for original Medicare, here is when we suggest you should, then your effective date is going to be on March 1st instead of April 1st. But for everyone else, it's going to be on the first day of your birthday month. Okay. So additionally, if you're receiving Social Security income benefits prior to turning 65, Social Security will automatically enroll you 3 months prior to your birthday month where you turn 65. And you'll get your cards about 3 weeks prior to the effective date, which is the first day of your birthday month. Okay. The next enrollment period that you want to know about is called the supplemental enrollment period, and it's also known as Medigap. This enrollment period begins when your Part B goes effective. So birthday month for those turning 65, and it provides a 6-month window to enroll in a supplemental plan where you cannot be denied for health reasons. A supplemental plan, also known as a Medigap plan, will fill in the gaps for if you're staying with original Medicare. And we'll take a look at that some more in depth here in a few slides. Okay. The next enrollment period to be aware of is called your annual enrollment period here, which is AEP. Okay. And that's for everyone. This is a time where you'll will review your coverage. You can review, if you made, changes to medications or doctors or that sort of thing. It's just a good time to review that. We have a process that we go through with you. We remind you, we allow you to update that stuff securely, and then we can run through some quotes if we need to make some changes for the following year. Okay. The other two enrollment periods, just to be aware of at this point, the first one here is called the open enrollment period, and that's for somebody that's already on Medicare, on a Medicare Advantage plan, the Part C plan. And if somebody missed their AEP and they get in a new year and all of a sudden realize, hey, this medication's not covered or doctor's not covered, then we can actually run quotes and compare, and you can change between Medicare Advantage plans in the first 3 months of the year, or you can actually disenroll and go back to original Medicare, both of which we can certainly help you with. And then the last enrollment period here is called the general enrollment period. And that's for those that have missed their initial enrollment period. So not something you want to do. That's why we recommend the discovery call 3 months prior. But somebody that has to sign up for the general enrollment period means they miss their initial enrollment period. They're going to have a most likely a coverage gap, and they would probably have to pay a lifelong penalty for Social Security. So that's why you don't want to miss your initial enrollment period. You don't want to miss that discovery call. Okay. All right, so let's look at Part A and Part B, also known as Original Medicare. So you can see there's some deductibles and out-of-pocket costs. So let's go ahead and take a look at those more in depth. Okay. Um, so these are the out-of-pocket costs that original Medicare does not cover and which you're responsible for. That's why people select either a Medigap, a supplemental plan to cover their cost, or an Advantage plan to cover those out-of-pocket costs. And both are good options. It just really depends on on your needs and what you're comfortable with. But both Part A and Part B have deductibles. They have coinsurance, and there's no annual out-of-pocket maximum. So that's why you'd want to get these costs covered through either a supplemental with Part D and stay with original Medicare, or an Advantage plan, which we'll take a look at those in detail in just a minute. Okay, the next area here is at the beginning. I had mentioned that for most people, your Part B premium is going to be the $202.90, and that is adjusted up for income. So if you're in a higher income bracket, you could be paying more for your Part B premium. That's why we said earlier, some people actually like to review these, what their income is at 62 and other things. Because they're going to look, it's called IRMA. It's called an IRMA chart, income related monthly adjustment amount chart. So when you sign up for original Medicare and get your sign up for Part B, they're going to go back 2 years on your tax return to determine what your adjusted gross income is. And so when you sign up for original Medicare, you're going to get a bill for the first 3 months. Generally, it's going to be for the 202.90 times 3, so about $609 is going to be your first month, and that's going to be followed by a second bill from IRMA if you actually triggered a higher amount, if you're making more money. Okay, so the IRMA is based off your tax return from 2 years prior. So if your most recent return puts you in a lower bracket, then the nice thing is you can go ahead and fill out an appeal. We can help you with that. But you would fill out an appeal and send that in to them, and then they would review that and then hopefully adjust that down for you. Okay, so there's also a similar chart for Part D. So if you trigger here on Part B for your premium, you're also going to see a slight adjustment on Part D, which is paid to Social Security, which we'll look at here in a couple slides. Okay. So I'm going to take you, make this as simple as possible, but at this point, we've just addressed, Medicare's Part A and Part B, your timelines for signing up and those associated costs. Now we're going to start looking at the two options for filling in the gaps and paying for your services not covered by original Medicare. So this is where we start going into detail on your two options. So before looking at your two coverage options that can cover the out-of-pocket expenses left from original Medicare, I want you to understand how they are similar to what you have now under your either your individual plan or your employer plan. Because right now you either have a PPO or you have an HMO. Okay, so a PPO plan, usually you're paying a higher premium, you have higher out-of-pocket costs, but it gives you more freedom. It's a larger network and less rules, right? Your HMO here is generally has a lower premium with lower out-of-pocket costs. However, you have a little bit less freedom. You have a smaller network. You're in a community-based care network, and you need to get authorizations and referral requirements. So if you're on an HMO, you're aware of those things. If you're on a PPO, you understand how that works as well. Okay. That said, both plans right now come with, your original come with Part D. So uh, you have all your coverage all in one. So your prescription drug plans are built into your PPO or your HMO. So when we go to original Medicare, that's where you're going to add a Part D, or it'll be included in your Advantage plan. And we'll take a look at that right now. So let's go ahead. We'll go in here. So everyone must get original Medicare, as I mentioned. Everyone has to sign up for original Medicare, and then you pick from one of two options to cover your out-of-pocket costs. So option one, I like to call a PPO model, right? So this is original Medicare, plus you're going to add a supplemental plan and Part D prescription drug coverage. Okay, so this would make you whole. Your only cost here is going to be a $283 deductible, annual deductible for Part B. Other than that, all your costs are going to be covered in this plan. With a Medicare Advantage plan includes Part A and Part B and Part D. So that's an alternative way to get your coverage. But let's go ahead and look at original Medicare with a supplemental and Part D. That's your first option, and to get your coverage uh, get all your out-of-pocket covered, costs covered. So when you have original Medicare, you're going to go see your provider. You're going to give them your card plus a supplemental card. They're not going to charge you for that. They're going to go ahead and bill Medicare. Medicare is going to go ahead and pay their portion, and then they're going to send the remaining balance billed to your supplemental or Medigap plan. Okay. Again, supplemental and Medigap are the same thing. It's called the supplemental. The older term is called Medigap. Okay, so you're only going to pay that $283 at the beginning of the year, and then the supplemental is going to pay everything else. Okay, so with the supplemental plan and your Part D drug coverage with original Medicare, you can go to any doctor, any hospital in the nation that accepts Medicare. And so you don't have any network. So you have a lot of freedom there. It also pays for all these additional out-of-pocket costs. So again, your only real cost there is going to be your $283 deductible. With the Advantage plan, if you go with option two, an Advantage plan or Part C works just like an HMO. So those choosing Medicare Advantage Part C will receive their benefits and coverage through private insurance. So they cover Part A and Part B, and they also include Part D as well. So you have generally no deductibles, low copays, if any. It just depends on the plan, and low or to even zero monthly premium for those here in California. So there are some plans that do have premiums, but most of them are zero premium still at this point. Okay, so this is going to work just like an HMO plan and gives you extra benefits as well. So this is what it looks like when you go with an Advantage plan. It's going to work like an HMO. It's going to cover Part A and Part B of original Medicare. It's going to include your drug coverage, and it's going to give you extra benefits like dental, vision, gym membership, hearing, and things like that. Okay. So these are your two options. So option one is your PPO option, original Medicare with the supplemental and Part D. It gives you the freedom to go to any doctor, any hospital in the nation, and you don't have any insurance oversight. If Medicare pays, then your supplemental will pay as well. So this gives you total freedom to go anywhere you want that takes original Medicare. Your second option is your HMO model called Part C. And that's an advantage plan and works just like an HMO. It includes Part A, Part B, and Part D. Okay, so those are your two main, those are your two options. So it's really similar to what you have now. And moving on, going to Part D, your prescription drug coverage, whether you purchase it inside your Advantage plan, whether it's included in your Advantage plan, or you purchase it separate to go with your supplemental and original Medicare, it works similar to what you have now built into your plan. Okay, so you've got different tiers, preferred generic, brand, non-formulary brand, and there's co-pays according to that. And so some of the plans on the generics, you have zero copay. Some you might have a small copay, but it's going to work similar to what you're used to. The other thing with the Medicare Part D prescription drug coverage, whether it's built into your Advantage plan or whether you purchase it separately, there's a $2,100 out-of-pocket maximum that you would pay in copay. So if you had, a medication formulary that was very expensive covered by the plan, then they're going to stop you out at $2,100. Now, if you're in the middle of the year and you get an expensive drug that is not covered by the plan, then we would work with you to try and find coverage outside, maybe to get a coupon or a discount or through a different pharmacy to get that cost covered into your annual enrollment period, where we can then requote you and make those adjustments for the following year. Okay? And this is just another way to look at that. Again, if most plans do have a deductible, but most of them you don't have to pay through generic. So if you have a generic on your Part D coverage, you're not going to usually have to pay through any deductible. It's usually for the brand and non-formulary brand, and then you're stopped out at $2,100. Okay, so the blue is you in this case. If it's part of your Advantage plan, then a lot of times there is no deductible, and you're just paying either a small copay for generics and a little bit larger copay for your brands. And again, you have a maximum out of pocket of $2,100. Okay, so here I mentioned before, if you trigger IRMA, where you're paying a little bit more than your standard Part B premium of $202.90, you're also going to trigger your Part D IRMA, so you're going to be paying a little bit more to Social Security on your monthly premium to them. Okay, so let's go ahead now. We'll just take a look at what our services are and how we can help you. So why you need an insurance agent or team that specializes in Medicare? Well, there's a lot of reasons. One, we get you educated. We schedule out everything for you so you don't miss any deadlines. We help you with, your comparing your plans and benefits. We go over your medications. We help you with your annual enrollment period, as well as getting you enrolled originally, and then we work with you each year to make sure that everything is going well, and any adjustments you need to make, we make those during the annual enrollment period for the following year. Okay. And this is how we work with you. This is our process. What it looks like to work with us, we have a simple process. One, we have what's called the discovery call, and that's where we, like 3 months prior to when you turn 65 or when you're going to elect your Part B coverage coming off a group plan, you want to set up a discovery call, and that's where we kind of get a good idea of what you're on now, what your doctors and medications and things like that. And then we put together, we'll send you some emails that you might need for the next meeting. So if you're going to maybe trigger IRMA, you're going to get an email from us on that. If you need to sign up for Part A and Part B, you get an email from us that gives you instructions on that. So that's everything we do after that discovery call, and then before our next meeting, which is a presentation. And the presentation, we go through again, like we're going through today. It's the basics of Medicare. We go through the basics of Medicare with you. We go through what your coverage options are based on your discovery call, the needs assessment we did with you. And then we go ahead and get you enrolled. And then the third meeting is what's called the orientation meeting. And that's usually a few weeks after you've been enrolled and you've received your welcome kit. We'll go through the plan with you. We'll answer all your questions. Again, this is on an online presentation and just makes it really simple. And that way we can answer all your questions, and we can also go over things that are not covered by original Medicare. And so that's important as well. And then we put together what's called it's a PDF that covers your plan. We just put everything together nice and simple with all the links and everything you need for your plan right on one document. So we try and make it really simple for you. Okay, and as I mentioned here at the beginning, with when we work with you one-on-one, you're going to have exactly what the cost is for your options. But we put this together just so you have a good idea of what those costs look like based on option one or option two. So if you go with option one, everyone's got to pay for Part B premium. So whether you have option one or option two, you're going to pay that. However, if you're going to stay with original Medicare, so you can go to any doctor, any hospital in the nation, and you're going to pick up what's called a supplemental plan that's going to pay for those out-of-pocket costs less than $283. So you're going to pay anywhere from $150 to $250 for your supplemental plan on top of your $200 and $290, and that's the base number. And it just depends on when you come in at what age. And then your Part D can be either a zero premium on up from there. So it just really depends on whether you're taking medications and whether they're brand or not as to how much your Part D. But for most people, it's either $0 to $5 for your premium for Part D. But like I said, if you're taking some really expensive medications, you could have a plan that isn't, upwards of $150 per month. But for most people, your average cost, if you go with option one, is going to be around $350 to $450. So it's going to include your Part B premium. It's going to include your supplemental premium, and it's also going to include your Part D drugs as well. So that would give you a comprehensive plan. So all in, you're about $350 to $450 per month. Okay. If you go with option two, your Advantage or HMO, also known as Part C, you're going to pay your $200 and $290, and then your premium here in California for most plans is $0. There could be a small premium here in California, and some plans outside California have premiums. But for this illustration here in California, you're going to be paying a $0 premium. And then that's going to also include your drugs as well, plus your extra benefits that we talked about earlier, dental and vision, things like that. So if you go with option two, that's going to be $202.90. So it just really depends on what you're used to, what you're comfortable with, what your needs are in your lifestyle as to whether you go with option one, which is the Part A, Part B, supplemental Part D, or option two, which is an Advantage HMO. So it's going to depend on those things. And we help you to be able to make that decision quickly and simply just through like this presentation we put together for you today. So thank you so much for joining us today. If you'd like to set up a discovery call or talk, you can sure reach out to us. You can reach me at the number here, or you can email me as well. If you're an employer or a partner, you can go to our site, RileyEBI.com. And if you're an individual, you can go to our site, Riley and Associates, which is MedicareSouthBay.com. And you can get set up a call with us there as well and get an additional information. So thanks for joining us. We really appreciate that. And we hope to work with you soon. Thanks.